What if the test you thought would protect you actually put your life at risk? It's happening every day, and most seniors have no idea. A 2022 study from JAMA Internal Medicine found that up to 37% of routine medical tests in older adults lead to unnecessary treatment, complications, or long-term side effects. That's not preventive care. That's a hidden danger. In this video, we're revealing 5 common medical tests that people over 70 are still told to take. Tests that sound helpful but may cause more harm than healing. We're talking about bone scans that scare you into risky medications, memory scans that trigger panic, and stress tests that push healthy people into the hospital. And these aren't just opinions. Every test we discuss is backed by clinical research, real patient stories, and safer, smarter alternatives that can help you stay healthy without risking your well-being. If you've ever walked out of a doctor's office confused, overwhelmed, or wondering, was that really necessary? This video is for you. And if you find this helpful, feel free to give it a like or share it with someone you love. Your health matters. Let's dive in. 1. Bone density scan. When a number becomes a sentence. It sounds harmless, doesn't it? A simple bone scan. No needles, no pain, just a quick test that tells you whether your bones are strong. But here's what most people over 70 don't realize. That quiet little scan, called a DEXA scan, can sometimes do more harm than good, especially when the result turns into fear. Let me ask you something. Have you ever gone in for a checkup feeling fine, only to leave with a piece of paper that says you're at risk? That's exactly what happens to thousands of older adults every year after a bone density scan. They walk in strong and confident, and walk out feeling fragile, broken, and old. All because of a number. And here's the shocking part. After 70, almost everyone will show some degree of bone loss. It's a normal part of aging, just like wrinkles or gray hair. But the DEXA scan doesn't always know the difference between natural aging and dangerous bone weakness. So even mild thinning gets labeled as osteopenia or osteoporosis, triggering panic. And the next step? Medication. The most common drugs prescribed are bisphosphonates, medications like alendronate. Maybe you've heard of them. Maybe you've even taken them. But did anyone ever explain what they can do to your body? These drugs may help preserve bone in some cases, but they come with risks that many seniors are never warned about. Stomach upset, acid reflux, pain in the jaw, and in rare cases, something called jawbone necrosis, a condition where the bone in your jaw literally begins to die. Now here's where it gets even more troubling. According to a large study published in the Journal of the American Geriatric Society, more than 1,200 women over 70 were followed for 5 years. They were given bisphosphonates to reduce fractures. The result? The fracture risk dropped by just 0.3%. That's less than 1/3 of 1%. Let that sink in. All that medication, all those side effects, just to avoid less than 1 fracture out of every 300 women. So here's a question for you. If you were told a drug might help you just a little, but might also upset your stomach, hurt your jaw, and make you afraid to move, would you still take it? There's another way, and it's not just safer, it's more effective. Research published in Osteoporosis International in 2022 showed that lifestyle changes, simple ones like daily walking, resistance training with light weights, and eating a diet rich in calcium and vitamin D can reduce fracture risk by over 20%. That's more than 60 times the benefit compared to the drug study I just mentioned. Let me tell you about someone I once knew. Her name was Eleanor. She was 75, sharp, active, and loved to garden. After a routine bone scan, her doctor told her she had osteopenia and immediately put her on bisphosphonates. Within weeks, she had heartburn so bad she stopped eating tomatoes and even quit going out to dinner. Months later, she developed pain in her jaw that made her stop singing in the church choir. When she finally asked for a second opinion, she was told her bone loss was mild and normal for her age. She stopped the medication. She began doing chair yoga, added canned sardines and leafy greens to her meals, and started walking 3 mornings a week. A year later, she felt stronger than ever, and her bone scan hadn't changed at all. So I want to ask you, what do you believe strengthens your body more? A pill with side effects, or a daily walk in the sunlight followed by a home-cooked meal? This isn't about ignoring health. It's about making smarter choices, choices that support your strength rather than steal your confidence. If your doctor recommends a bone scan after 70, ask questions. Have you had any falls? Do you have pain or weakness? If not, it may be wiser to focus on balance, muscle strength, and proper nutrition. Your bones are alive. They respond to movement, pressure, and food. You're not just a number on a chart. You're a human being with the power to grow stronger at any age. Have you ever taken bone medication and experienced side effects? Or do you have your own way of staying strong as you age? I'd love to hear about it in the comments. Because here's the truth. Health isn't just what's written in your test results. It's how you feel, how you move, how you live. And you deserve to feel powerful, not scared, every time you leave your doctor's office. Let's keep building that strength. One step at a time. 2. Brain MRI. Seeing more worry, not more clarity. We all forget things sometimes. Misplacing your keys, forgetting someone's name, walking into a room and wondering why. It's common. It's natural. And after 70, it happens more often than we'd like to admit. But here's the problem. What starts as a harmless memory slip can quickly spiral into fear. Fear of dementia. Fear of losing control. And that fear often leads to a common response. Let's get an MRI to make sure everything's okay. At first glance, it sounds like the smart thing to do. But in many cases, that MRI does something far worse than reassure you. It plants a seed of panic that's hard to shake. Let me explain. A 2021 review published in Neurology Today looked at over 3,000 brain MRI scans in seniors aged 70 to 85 who reported mild memory issues. The results? 86% of those scans showed some kind of abnormality. But here's the real shocker. Only 3% were linked to any treatable condition. That means most people were told there was something there, but it didn't actually mean anything dangerous, just age-related changes. Normal wear and tear on a brain that's been working hard for 7 decades. But when you're told you have white matter lesions or mild brain atrophy, how do you not panic? Those words sound serious, scary, final, and for many seniors it changes how they see themselves. I've seen this happen too many times. A perfectly active, independent older adult gets an MRI just to be safe. The doctor says it shows minor abnormalities. Suddenly they stop driving. They pull away from friends. They start using words like decline or early signs. Not because they feel worse, but because they believe they are worse. And in some cases, that belief becomes a self-fulfilling prophecy. It gets worse. Some people, after one unclear MRI, are sent for follow-up tests, spinal taps, PET scans, even exploratory brain biopsies. All of this because an image looked a little off. Yet in the vast majority of cases, the person's memory hasn't changed at all. Let me tell you about Marvin. He was 74, a retired teacher who still tutored part-time and played chess every Saturday at the senior center. One day, he forgot the name of a new neighbor. His daughter worried and pushed for a brain MRI. The scan came back with age-appropriate changes, but the wording shook him. He became withdrawn. Stopped teaching, stopped going out. He said, "What's the point? My brain's starting to go." 6 months later, his memory wasn't worse, but his mood was. His activity level had dropped. He felt older, not because he was, but because he believed he was. And all of it started with a scan that revealed nothing serious. So what's the better alternative? Instead of jumping to an MRI, start with a simple cognitive screening test. It's done on paper. It takes 10 to 15 minutes. It checks how well you think, remember, and solve problems. It doesn't involve machines or radiation. And most importantly, it gives you real answers about how your brain is working today, not guesses based on images. This test is what neurologists and memory clinics use as a first step. It's affordable, it's accurate, and it won't scare you into thinking something's wrong when it's not. Now, I'm not saying MRIs are always bad. If someone has severe or sudden symptoms, like personality changes, seizures, or trouble speaking, they absolutely have a place. But for mild forgetfulness, for everyday slips that come with age, an MRI often creates more confusion than clarity. And here's something to remember. Your brain is not a photo. It's a living, changing, complex system. Looking at it through a machine doesn't always tell the full story. So let me ask you, if you were told there's something possibly abnormal on your scan, but no clear solution, no treatment, no pain, would you want to know? Or would you rather focus on how you feel, how you think, and what you can do today to stay sharp? Leave a comment and let me know. Have you or someone you love ever been scared by a scan that turned out to mean nothing? Or have you found better ways to stay mentally strong over the years? Your experience matters, and your story could help someone else take a breath and make a wiser choice. Because at the end of the day, your peace of mind is just as important as your medical results. So if your memory slips now and then, don't jump to the worst conclusion. Slow down, take the right first step. And most of all, don't let fear write your story. 3. Cardiac stress test. The trap that catches the healthy. Have you ever felt just a little tired after climbing the stairs? Or maybe a bit winded after walking in the sun? It happens. Especially after 70, a little shortness of breath can feel normal. But for many seniors, that simple fatigue turns into a red flag. And before they know it, they're sent in for a stress test. Now here's the danger. If your heart is fine, but the test says otherwise, you could end up on a path that changes everything. Not because you're sick, but because the test was wrong. A cardiac stress test is designed to check how well your heart works under pressure. You either walk on a treadmill or get medication that makes your heart beat faster, simulating exercise. Doctors monitor your heart rhythm, blood pressure, and breathing. Sounds useful, right? But here's the catch. According to multiple studies, including data published in JAMA Cardiology, the false positive rate for stress tests in adults over 70 is up to 40%. That means almost half the time the test shows a problem where there isn't one. Imagine being told you have a blocked artery when you don't. And what happens next? More tests, angiograms, cardiac catheterizations, maybe even a stent placement. You start taking blood thinners, you're told to avoid certain activities, your independence shrinks, all because of one misleading test. Let me tell you about a man named Frank. He was 75, a retired mailman who still walked every morning around his neighborhood. He mentioned to his doctor that he got a little tired walking uphill on hot days. Nothing alarming, no chest pain, no shortness of breath. Still, the doctor ordered a stress test just to be sure. The result came back borderline abnormal, so Frank was sent for a catheterization. During the procedure, they found a mild narrowing and placed a stent. But afterward, Frank had a reaction to the contrast dye used in the test. His kidneys were damaged. He spent 6 days in the hospital and had to follow up with a nephrologist for months. Here's the worst part. His fatigue didn't improve because it was never a heart issue to begin with. He just needed better hydration and a little more rest between meals. Now I want to pause and ask you something important. If you felt fine 1 week and ended up in the hospital the next, just because of a precautionary test, how would that make you feel? This isn't about ignoring symptoms. If you're having true warning signs, like chest pain during activity, shortness of breath with minimal effort, or lightheadedness that leads to fainting, then yes, testing makes sense. But for many seniors, a resting EKG is a safer first step. It checks your heart's rhythm while you're relaxed, without stress. Another excellent option is a coronary calcium scan, a low-radiation test that looks for plaque in your arteries. It's fast, accurate, and doesn't involve putting anything into your body. So why are stress tests still used so often? Sometimes doctors want to be extra cautious. Other times, it's routine, part of an outdated checklist. And in private clinics, more testing often means more billing. That's why you have to be your own advocate. Ask the right questions. Say things like, what are we trying to rule out? What happens if the test shows something unclear? Are there safer options for someone my age? You don't need to accept every test just because it's offered. You have the right to understand the risks, the benefits, and what comes next. Because once you're on the medical treadmill, it's hard to get off. Let's be honest, no one wants to ignore a real heart issue. But over-testing the healthy can be just as dangerous as missing a diagnosis. So here's my advice. Pay attention to how you feel. Stay active. Get regular checkups. But if your heart is steady and your symptoms are mild, don't let one moment of fatigue turn into months of recovery. Have you or someone you know ever had a stress test that led to more problems than solutions? I'd love to hear your story in the comments. Your experience can help others pause before they say yes to a test they don't need. And if you find this video helpful, consider sharing it with someone you care about. You might just save them from unnecessary worry or an unnecessary hospital stay. Remember, your health isn't just about tests. It's about how you live, how you move, and how you feel. You're not here to be hooked up to machines. You're here to enjoy your life. 4. Colonoscopy. Once life-saving, now often risky. After 75, colonoscopy has saved lives. There's no doubt about that. It's one of the most effective tools we've ever had to detect and prevent colon cancer. But here's a truth that rarely gets talked about. After the age of 75, this powerful tool can quietly turn into a serious risk. You see, many seniors continue to receive colonoscopies out of habit, not because there are symptoms, not because there's real concern, but because it's what they've always been told to do. You're over 70? Time to schedule another one. But should that still be the case? Let's look at the numbers. A 2019 study published in JAMA Internal Medicine reviewed the health outcomes of over 1.3 million seniors on Medicare. What they found was eye-opening. For every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved from colon cancer. But more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. So what are we talking about when we say complications? We're not just talking about minor discomfort. We're talking about bowel perforation, heavy bleeding, infections, and even kidney failure due to the strong laxatives used to clear your system before the procedure. And don't forget the sedation itself. Many older adults don't react well to the drugs. It can lead to confusion, memory fog, or a sharp decline in balance and coordination for weeks. Let me tell you about someone I'll never forget. Her name was Margaret. She was 73, running a small bakery with her daughter. Healthy, active, no digestive symptoms. But her new doctor insisted on a colonoscopy because it's routine at your age. She agreed. During the procedure, a small polyp was removed. That evening, she had severe abdominal pain and fainted in her kitchen. She was rushed to the hospital, diagnosed with a bowel perforation, and stayed 9 days in recovery. She lost 10 pounds, struggled with fatigue, and never quite regained her old rhythm. And here's the part that still bothers me. She had already had 2 clean colonoscopies in the past. There was no urgency, no clear reason, just a box to check. So I ask you, was it worth it? Now, this doesn't mean colon cancer screening isn't important. It is. But the right test at the right time matters just as much as the test itself. For most people after age 75, routine colonoscopies are no longer recommended by the U.S. Preventive Services Task Force, unless you have specific symptoms or a strong family history of colon cancer. So what should you do instead? Consider the FIT test, a stool-based screening you can do right at home. No prep, no fasting, no sedation. You simply collect a small sample and send it to the lab. It's fast, non-invasive, and still effective at catching early warning signs of colon cancer. It may not be flashy, but it's safer and far more suitable for seniors who aren't showing symptoms. Now, I want you to think about this honestly. Have you ever had a medical test just because you felt like you should, or because it was part of a checklist rather than a personalized decision? The medical system has done a great job of promoting screening, but what it hasn't always done well is telling us when to stop. And stopping isn't neglect. It's wisdom. If you're not experiencing bleeding, changes in your stool, unexplained weight loss, or stomach pain, and especially if your last colonoscopy was clean, you may not need another one. And you have the right to say, no thank you. This is your body, your timeline, your decision. I'd love to hear from you. Have you ever had a colonoscopy that caused problems, or a moment where you questioned whether a test was really necessary? Let me know in the comments. Your story could help someone else pause and think twice. And if this video helped you rethink something, or brought a bit of clarity to a confusing subject, consider sharing it with someone you love. A simple conversation can save someone from a lot of stress, or even a hospital bed. You've earned the right to make informed choices. Not based on fear, not based on pressure, but based on what's truly best for you. Because living longer is important. But living better, safer, and with peace of mind? That's everything. 5. Full body CT scan. No disease found, but trouble guaranteed. Imagine walking into a private health clinic feeling perfectly fine and walking out with a lung biopsy, a collapsed lung, and a 2-month hospital stay. All because of a tiny dot on a scan that turned out to be nothing. This isn't a rare horror story. It's the silent risk behind one of the most overused medical procedures for seniors, the full-body CT scan. On paper, it sounds like a great idea. A high-tech scan that checks your entire body for hidden problems. No symptoms? No problem. Let's find things early, right? But here's the reality. A full-body CT scan without symptoms is not prevention. It's a gamble. And often, it's a dangerous one. According to a 2023 modeling study published in JAMA Internal Medicine, the rising use of CT scans across the US may now be responsible for up to 5% of all cancers. That's right, 1 in 20 cancer cases may be caused by the radiation from these scans, not detected by them. Let that sink in. A single full-body CT scan delivers between 10 to 20 millisieverts of radiation. That's the equivalent of about 500 chest x-rays in one go. And if you repeat this every year thinking it's good for you, that radiation exposure stacks up fast. But the danger doesn't stop at radiation. These scans often pick up tiny, harmless findings, small nodules, cysts, or calcifications, things your body has likely had for decades. But the moment those show up on a screen, they trigger red flags. More tests, more appointments, more fear. Let me tell you about someone we'll call Mr. Harold. He was 80, full of energy, and even taught martial arts to other seniors. He felt great. No symptoms. But during a high-end executive health checkup, he was offered a full-body scan. They found a tiny 3mm nodule on his lung. The doctor said it's probably nothing, but let's be safe. So Harold went for a PET scan, then a biopsy. The result? Benign, totally harmless. But the biopsy caused part of his lung to collapse. He ended up in the hospital for 2 weeks and spent 2 full months recovering. All of this, from a scan he didn't need, looking for a disease he didn't have. Now I want to pause and ask you, honestly, would you rather have peace of mind or a picture that steals your freedom? You see, these scans are marketed as advanced wellness tools. But the truth is, if you're not showing symptoms like coughing up blood, unexplained weight loss, or pain that won't go away, there's no proven benefit. In fact, the American College of Radiology strongly advises against full-body CT screening in asymptomatic adults. Their words are clear. There is no scientific evidence it improves outcomes, and there is significant potential for harm. So why are these scans still pushed so hard? Partly because of fear, partly because of money, and partly because it's hard to sell do nothing as healthcare. But doing nothing isn't ignoring your health. It's understanding when less is more. Now, if you do have persistent symptoms or a strong family history of a certain condition, then targeted scans may be appropriate. But scanning your whole body, just in case, that's like digging up your entire backyard because you thought you heard a mouse. So what should you do instead? Listen to your body. Stay in tune with how you feel. If something doesn't feel right, don't ignore it. But if you feel well, focus on what truly keeps you healthy. Movement, good sleep, nutritious food, and real conversations with a doctor who knows you, not a machine that doesn't. I'd love to hear your thoughts. Have you ever had a test that found something, only to later discover it was harmless? Or have you been offered a full-body scan and weren't sure whether to say yes? Drop a comment below, I read every one. If this video helped you rethink routine tests or gave you the words to ask better questions, please consider sharing it. You might help someone else avoid a long road they never needed to walk. And always remember, just because we can scan everything, doesn't mean we should. You are more than a shadow on a screen. You are a person, living, breathing, whole. Let's keep you that way. As we age, protecting our health isn't just about doing more tests. It's about doing the right ones, at the right time, for the right reasons. Because sometimes what seems like routine care can quietly lead to stress, side effects, or even harm. In this video, we've explored 5 common medical checkups that may sound helpful, but for many people over 70, they're simply not worth the risk. Not when the science shows little benefit. Not when real lives have been disrupted by unnecessary procedures. So what's the better path? It's choosing smart, personalized care. Listening to your body, asking thoughtful questions. Focusing on lifestyle, strength, and peace of mind. rather than chasing problems that may not exist. You deserve a healthcare experience that honors your wisdom, your time, and your well-being. If any part of this video spoke to you, I'd love to hear your story in the comments. What's one test you now feel more confident saying no to? Or what's one question you'll ask your doctor at your next visit? And if this helped you, share it with someone you care about. Because good health isn't just about living longer, it's about living better. We'll see you in the next video.